Thank you so much for sharing your expertise. It's highly appreciated. And only a few very short and brief questions. So first of all, just for the patients to know. So if they have developed urticaria at any point in their pregnancy or giving birth, directly after giving birth or during the lactation period, and I already briefly mentioned that it tends to act a little bit more like autoimmune disease. Should they seek any help or any advice or any further investigation for any additional health conditions that may relate it with that, or is it completely not necessary?
Of course, it's a very interesting question. Yeah, it is. Sorry, I didn't catch the first step. So, if someone develops urticaria before pregnancy or during pregnancy, if they should seek any other
Exactly.
help
Any other clarification of any other potential development of new diseases that may or may not be related with the pregnancy?
with the pregnancy? Well, that's an interesting question. Maybe Emek, you have some experience with that. I actually, I mean, I'm not aware of anything that's linked to urticaria and another disease that could present during pregnancy, but maybe you
That's
know
great.
a different one.
So we have some pregnancy dermatosis, maybe, and one of my patients, so interestingly, she had chronic urticaria, and then she developed a pregnancy-related dermatosis. So it was very interesting for me. For example, it's
Okay.
never reported before, but it can be.
But that's something new.
I'm not aware of others. Yeah.
Okay, so that is not a rule that the patient should have more stress, more exacerbation of the stress if they develop urticaria. It's only this disease, and we manage first of all the urticaria. And the last very brief questions to Marlene. So for the patients that are about to give birth and suffer from urticaria, do they need to take any precautions, or can they just go further on normally to giving birth?
Well, in general, again, it's very individual. It depends on how, what situation you're in, if the flare up is intense, etc. But in general, there does not seem to be any adverse effects with having urticaria or taking medication for urticaria up until giving birth, really. There's just one thing, if you have contact urticaria, that can sometimes be related to latex, for example. Of course, the obstetric team should be aware of that. And in general, they should be aware that you have urticaria and that even if you have like a flare up, that they should be aware so they know what's going on and can put this, really know, okay, this is due to this underlying condition. And as Emig also said, I think communicating is the most important. So really tell your physician, tell your healthcare providers what's going on, but also like have them communicate with you.
Perfect. Thank you
I
very much.
also
We
want
have
to add one point that was also Marlene. In our study, we found that cesarean type of delivery was more common in urticaria patients. And it was not associated with other diseases or twins or something, but it was only associated with age. But so urticaria patients maybe felt more stressed and they wanted to go to the cesarean section, maybe just they wanted, or I don't know. If they can want in Germany, I don't know, but in Turkey, they can select their way of giving birth.
I mean, it's really, that's super interesting. I did not find any data before that regarding the birth mode or differences. That's super interesting. But I think it's very multi-causal. As with everything, it could be stress. It could be just because you don't feel comfortable or well that you choose to have a cesarean. Or, but in Germany, actually, you can not completely choose the way of delivery. Of course, you can to a certain extent, but you will be advised to try for vaginal birth if possible. But if you go to a consultation due to urticaria, then you may want to have a cesarean section. That could be possible as well. But I would be very curious to see that data. That sounds so interesting. Yeah, but in general,
Yes.
It's not necessary if you feel okay, if your urticaria is under control, it's not generally necessary.
perfect.
Yes.
Good. So thank you very much,
Yes.
first of all, and we'll get back to the question and the discussion in a short bit. And like to ask Salai to step into the stage and share with us tips and tricks for managing mental health as a new mother and managing the chronic conditions in addition to that.
Hello, everyone. Let me share my screen.
Great. Thank you very much.
Hello, everyone. First of all, it's a pleasure for me to talk here today. My name is Zelal Şahin Tırnova, and today I will talk about managing your mental health as a new mother with a chronic condition. First of all, this is my own urticaria story and my own experiences. I'm a doctor, and this disease made me understand the patients much better as a doctor. Here you can see 4-day-old me. I was hospitalized because of newborn jaundice. I'm 38 years old and I live in Istanbul, Turkey. I'm an internal medicine specialist and I continue my subspecialty training in geriatrics at Istanbul Faculty of Medicine. As a child, I was often sick. Although I didn't have any serious illnesses, I frequently visited the doctors for upper respiratory infections and similar issues. Naturally, I hated hospitals. They say hate and love are close feelings, so maybe that's why I became a doctor. Sorry. My chronic urticaria was started in primary school and it did not respond to the antihistamines given to me at that time. I had to take intermittent steroid treatments. And since the doctors thought my allergies were due to foods, I had to follow strict diets during my childhood. And I already didn't have a good appetite. These diets made me even thinner. Fortunately, my immune system got better with adolescence and relieved my allergies for a while. Later, in medical school, I learned that I had Hashimoto's disease and that my urticaria was actually caused by the autoantibodies responsible for this disease. This is me at the 4th year of medical school. Although I occasionally had flare-ups of urticaria, I was able to manage the condition until my baby was born. My son Atlas was born in April 2020 at the beginning of the COVID pandemic. When he was 3 or 4 months old, my symptoms started again. At first, they were moderate, but then the lesions increased rapidly and they became unbearable for me. Unfortunately, my lesions didn't respond adequately to the antihistamines or even steroids. At first, it was my first time being a mother. I was very anxious and I was very tired. On top of that, the COVID pandemic broke out. My husband, who is also a doctor, a surgeon, was working under high risk and the vaccines had not been yet developed. I was trying to take care of my fully dependent baby alone and avoid contact. I was trying to avoid contact with my husband, who was working on the front lines of the pandemic. I was breastfeeding and I was more concerned about my baby's health than my own. Unfortunately, this anxiety made things worse. Here you can see the lesions were very common almost all over my body. Finally, I started experiencing severe stomach pain due to the steroids and all the medications I was taking. And one evening, I found myself breathing in pain in the emergency room. Even though I was a doctor, I was very helpless and I didn't know how to get better. Luckily, I met Dr. Türk. She entered my life like a superhero. She first calmed me down. Then she offered me giving this medicine called omalizumab. It was a much safer medication for both the baby and me. I trusted her and I began the treatment. I took my first dose, as you can see here, first dose of omalizumab. A day after the dose, it was like a magic wand had touched me. I had no lesions, almost no lesions, for the first time in months. I completed my treatment and my disease went into remission again. That period was really tough for me and I feel itchy just talking about it. Being a mother is already very challenging, but trying to care of a tiny baby alone in the middle of a pandemic while dealing with such a severe symptoms and the disease that greatly affects quality of life was even more difficult. Now my son Atlas is 4 years old. Setting aside my worries about him not getting breast milk and his development falling behind, he was breastfed for 3.5 years. And now he is a robust, healthy child, and he's bigger than his peers. Atlas presented his first portfolio here for the first time in his life. And as his parents, we were more happy than I can even describe. I embrace and congratulate all the mothers listening to me here, and thank you for listening to me.